Okay, so hello there. I'm Roger Stancliffe. I'm Professor of Intellectual Disability at the University of Sydney Faculty of Health Sciences, and I'm the Course Director of the Master of Health Science in Developmental Disability. This course is well established, has been running since 2002, and I've been teaching on it, as have the other people I'll introduce you to, for quite some time. I'm going to turn off my webcam now, and so you can concentrate just on the slides. By the way, I should explain that although I can't hear or see you, you can ask me questions by typing in your questions in the little question window. You can type them in at any time, and I'll try to keep an eye on that window as we go along, and I'll be asking for questions at the end. So let's see how we go. This presentation overall, including your questions, should take between 30 and 35 minutes. This is being recorded, as you know, so people who are unable to join us live can view it and watch the recording. So if you ask a question, they'll be able to see the question you ask and who asked it. So just be aware of that. Okay, so moving along, what really important development in Australia, as you all know, is the implementation of the National Disability Insurance Scheme. And I was at a presentation in Melbourne in November by Bruce Bonnehady, the chairman of the National Disability Insurance Agency, and he said, the words in the quotes at the top there, around 70% of the participants in the NDIS have an intellectual disability. So I really want to emphasise that, because the NDIS is a hugely important change in disability services in Australia, and is the source of many important opportunities for employment and for innovation. And clearly, with those sorts of numbers of people with intellectual disability, as well as others with developmental disability without intellectual disability, such as cerebral palsy or autism, then intellectual and developmental disability are of fundamental importance to the NDIS, and anybody who is deeply knowledgeable about those topics as a result of having done a course like this will be very well placed to contribute to the implementation of the NDIS as we go along. So I think that's an important contextual thing to be aware of. I want to introduce you to some of the people who teach on the course, and three of them are pictured there, and I'll introduce you to those three academics in turn. But it's important to recognise that each of those people are very internationally prominent researchers in the intellectual and developmental disability field who have worked in that field essentially all of their career. And all of us, or almost all of us, certainly the three pictured there, are people who have worked as clinicians, often for decades, and sometimes still work clinically, but also major contributors to research in the intellectual and developmental disability field, and have written many of the research articles and books that you'll be studying as part of your program. So Professor Stewart is a psychiatrist who specialises in intellectual and developmental disability. He teaches 2 units of study, the one on autism spectrum disorders and one on mental health, developmental disability. As it happens, both of those units will be offered in 2016. And you'll see in the orange writing toward the bottom of the screen there that there's a web link there that you'll be able to follow if you want to look at this later on from the recording, which you'll all have information about how to access. There's a web link there that will take you to information about Stewart and tell you all about his research, his publications and background and so forth, so you can find out much more about the people who are teaching the unit through following those links. In my case, I teach one of the core units, that's Critical Issues Developmental Disability, which is offered in semester 1 of each year, and usually that's the first unit that people take as part of their program. And I also teach another elective unit. The core units are compulsory, the elective units are ones that you choose to enrol on if you wish, and I teach the elective unit on community living, and you can see there's a link there for more information about me. And on the right of the screen there is the front page of an example of one of the research articles that I've published in recent years. This is work done in collaboration with my colleagues at the University of Minnesota in the United States, where I've had a long-standing involvement. And that illustrates yet another important feature of the teaching in the program, and that is that all of the teachers and the content, are very well internationally linked. So you get not only the best of research and information from Australia, but the best from all around the world. Professor Gwyneth Llewellyn, you can see a book there that she co-edited with international colleagues about parenting by people with intellectual disabilities, and she teaches the elective on parenting with developmental disability, and I think that unit is a very nice example of one of the things that we pride ourselves on in this course, and that's tackling some of the more difficult topics, and parenting is certainly one of those, and likewise we have a unit on sexuality and developmental disability, which is also one of the issues that sometimes people tend not to think about, and we believe it's important to look carefully at what's happening in that area and what we know about that topic. In addition, Gwyneth teaches the disability theory unit of study, which is also a core unit of study, and that is offered each year in semester 2. And there's a link there to find out more about Gwyneth. Next I'm going to turn to information about the overall structure of the course and the units of study that are offered, so that you understand what it is that hopefully you're going to enrol in. There are two related and complementary qualifications. One is the Graduate Certificate of Health Science, and the other is the Masters. So turning to the Graduate Certificate, it's a much shorter course, although all the units of study are common, so both the Graduate Certificate and the Master's students study these units together. The two core units that I mentioned, Critical Issues and Disability Theory, are core units for both programs. And the Graduate Certificate students have to do at least one other developmental disability elective, although they can do two, and they can do a maximum of one faculty or university elective, and those are electives about other related topics which are not developmental disability specific. So you can do those, but you're certainly not required to. But you must do at least one developmental disability elective. Because the two core units are offered in semester 1 and semester 2 respectively, it takes 2 semesters in order to complete this program. For any international students who are listening, just a reminder that in Australia the academic year is the same as the calendar year. Semester 1 begins in late February, early March, and semester 2 begins in late July and completes in November. Now the Masters is a much more in-depth program, and it involves 12 units, the same core units. It also has a capstone unit, which is an individually supervised unit of study where you do a project related to an area of interest under the supervision of an academic with special knowledge in that area. In addition to the core units, again, master's students have to do at least 4 developmental disability electives, can do more, and the full-time minimum to complete this is 3 semesters, and the part-time minimum is 6 semesters. A full load for full-time students is 4 units of study per semester. A full part-time load is 2 units of study per semester, but we do offer some flexibility in the number of units, and you don't always have to take a full load. It's possible, as that arrow shows, to articulate from the graduate certificate to the master's. So some people originally enrol in the graduate certificate to take on a smaller commitment to see how they find the program, and many of those people like it a great deal and sign up for the full master's having completed the graduate certificate. Turning now to the specific units of study, I've already introduced the 2 core units, which you can see in the box in the top left of your screen there, Critical Issues and Disability Theory. I've also mentioned the capstone unit, and that's compulsory but only for the master's students and is not available for the graduate certificate students. And there are various formats of that capstone unit. including a 12 credit point dissertation format, which is intended primarily to prepare people for postgraduate research in the developmental disability field. And I'll introduce you to a former student who's currently doing a PhD as we go along. In addition to the core units of the capstone, there are 10 developmental disability electives, which you'll see on the specifics of those on the next screen. And I've already mentioned faculty and university electives, of which you can do a small number if you wish to move beyond just the developmental disability field. So, the electives. Core units in the dark orange, in the lighter orange here, the various electives, and those in the circle are units that will be offered in 2016. So in semester 1, we're offering physical health, mental health, and critical issues. In semester 2, disability theory, autism, spectrum disorders, and work and developmental disability. And the capstone units are offered in every semester, both semester 1 and semester 2. So those are the available units for 2016. The way that we operate with the other electives that you can see listed on your right of the screen there, such as sexuality, communication, positive behaviour, support, community living and so forth, is typically those electives are offered every second year. The vast majority of our students are enrolled part-time and working in the developmental disability field full-time or substantially full-time. So over the course of their enrolment, as I said, a minimum of 3 years for the Masters, each of these electives comes up, and so you'll have the opportunity to study those electives at some point during your program, but not every elective is available every year. So let's just hear from a few former students about the features of the program that they found helpful and positive in their experience of doing the program. I mentioned one of the students, and this is the student involved, Peter Smith. He's currently doing a PhD at this university related to developmental disability. And as you can see from his comments there, first of all, he was impressed that the flexible online learning still gave him access to highly acknowledged leaders in the developmental disability field, but people who still have that practical knowledge of working with clients and have worked as clinicians during at least part of their career. He enjoyed the applied nature of the course and draws our attention to the fact that one of the huge benefits of being a student at the University of Sydney is that you have online access to the university's library. For those of you who haven't studied for a while, the tens of thousands of research journals that are available through the university library are all now available to you electronically, usually going back 10, 15, 20 years or more. So it's possible for you to access this fantastic treasure trove of knowledge from your laptop, from your computer, from home, or wherever it is you're going to be studying, without the need to actually come into the university and attend classes. This entire program can be completed without ever physically being present at the university, although of course you're welcome to come in to do use the library, meet your lecturers, discuss things face-to-face, or even attend some of the university electives that are offered as face-to-face classes. Laura Hogan's an occupational therapist who did the program a few years ago, and she reminds us that this is a multidisciplinary program. So we have students from a wide variety of disciplines: OT, speech, physio, nursing, medicine, teaching, disability, and so forth. And I think that's one of the enormous strengths of the program, because disability services are inherently multidisciplinary, given that people with disability need support in a wide range of areas of their life. And so learning about developmental disability in a multidisciplinary way and learning from colleagues and fellow students who have different disciplinary backgrounds is immensely enriching. And as she said, it broadened her scope of practice and enabled her to move beyond ideas and principles that are not traditionally part of the occupational therapy worldview. Likewise, Edward Burt points out that doing programs like the Masters keeps you in touch with what's going on at the cutting edge of research and policy. We're constantly refreshing the material that we present you with, and we try to sort through resources that are not only of academic interest to you as students, but also of practical applicability to you in your work context as disability practitioners. And we're very careful about selecting the best of the best from around the world. So you get the best and the most recent. Alana Kerr is a speech pathologist, and her experience was very interesting, and this may be of interest to some of you online or some of other people that you know, in that one of the great benefits of a fully online program is you can study from anywhere. So Alana actually completed all or almost all of her study while living in Europe and raising 2 small children, but was still able to study at an Australian university. She's an Australian, in English, paying Australian domestic fee rates, even though she was on the other side of the world. And likewise, some of our students spend part of their program away from home, but they're still able to continue their studies. Finally, Nicky is a recently graduated student. I attended her graduation ceremony in December this year, and she finished the program at the end of semester 1 in 2015. And there's a link there to, I won't follow that link at the moment because it doesn't show up very nicely on this webinar format, but there's a short 2-minute video which you can view by following that link, which shows Nicky discussing her work where she was working at the time supporting people with intellectual disability to work in open mainstream employment, and how the Masters helped her with that work. It's a terrific little program. I recommend it to you. And so those are a range of views from a range of former students, but one of the great things about the multidisciplinary group of students and the highly experienced group of students, because many people, including a number of those who you've just met, have worked in the field for years or decades, and they bring a huge amount of knowledge, experience, resources to the table in our online discussions of various discussion questions. Those are what we do by way of tutorial discussion, and you can learn a great deal from your fellow students. I certainly learn a lot from them, and I'm happy to have them suggest good resources which I then vet and make available to other students, and that way we all help one another. Okay, now getting down to the administrative and financial side of things. Firstly, the application date for both domestic and international students for enrolment in 2016 is the 31st of January. It's important to understand that you apply directly to the University of Sydney's Faculty of Health Sciences at the web address shown on the bottom left-hand side of the screen. This is not an application through the University Admissions Centre, but direct to the faculty. This is a fee-paying course, and you can see that the fee is illustrated there, $3,000 for a 6 credit point unit, so you can do the maths as to how much that's going to cost in the Masters for the total of 12 units, and international students' fees are commensurately higher. Australian students are eligible, if they wish to take it up, to use the Australian Government's Feehelp loan facility to pay for tuition. Of course, you have to pay the loan back, but it enables you to get the money up front to pay your fees. And eligible students can request the Feehelp assistance online to pay for all or the unpaid portion of their tuition fees. And like the old HEX scheme, that loan debt is recorded against your tax file number, and you pay back your loan through the tax system like HEX, and also like HEX, unless you have to earn above the minimum income threshold in order to pay anything back. If you don't exceed that income threshold, you pay nothing in that tax year. I warn those of you who are not Australian citizens that there are strict eligibility requirements on Australian government Feehelp. So, as I understand it, international and New Zealand students are not usually eligible for Feehelp, but you should go to the address on screen there at the bottom left in orange and make your own inquiries as to whether or not you're eligible. Admission requirements. Most straightforward admission is if you have a undergraduate bachelor's degree in a related discipline, and that's a wide variety of disciplines amongst the different disciplines that I mentioned previously, from the therapies to education, psychology, disability, nursing, and medical related degrees and the like. And that said, there have been occasions in the past, and there will continue to be in the future, where we do approve enrolment for people who don't have a bachelor's degree but some other form of post-school qualification, and who also have experience in the developmental disability field. And so a classic example of that might be somebody who's been a nurse in the field for several decades, who originally did their nursing training before nursing was offered in universities, and so they don't have a bachelor's degree in nursing, but they have a nursing qualification and experience, and so we've typically allowed those people to enrol, often suggesting to them that they enrol first in the graduate certificate program and then upgrade to the master's if things work out well. And of course, students who've completed the graduate certificate may also apply to articulate to the master's. Now, say I've got a question here from Ross. How much would it be in total for an international student? Going back to the previous slide, you can see the amounts there. So for the master's program, which involves 12 units of study, 6 credit points, that's 6 CP means 6 credit point units. So the total would be that figure, 5,250 times 12. Likewise for domestic students, 3,000 times 12 for the 12 units. In the case of the graduate certificate, there are 4 units of study, so 4 6 credit point units, so multiply those numbers by 4. And those students who articulate from one to the other, they can have their graduate certificate units counted in their masters, and so they only do a total of 12 for the masters, the 4 from the graduate certificate plus 8 additional units. In some instances, it is possible to apply for credit for previous study, but that needs to be postgraduate study, and that is dealt with on a case-by-case basis. Okay, I'll just move back to where I was before about admission requirements. So bachelor's, some people without a bachelor's have been able to get in with some qualifications and relevant experience, and you can articulate from the graduate certificate to the master's. So these are my contact details, and I'd be happy to hear from any of you via email or via phone if you have questions that you don't want to share in this forum. But now I'd like to turn it over to you to ask questions by typing in the question space so that I can answer your questions and other people can hear see your question and hear my answer, so that they too can be informed about that. So please fire away with your questions, and I'll try to answer them as best I can. Okay, I'm just waiting for people to start typing on this. Okay, the next question is, when will applicants receive notification about admission into the course? I'm not the absolute best person to answer this, because I see some of the applications, but most of that is handled administratively. As mentioned, the closing date is the end of January, the end of this month, and these applications are dealt with within this faculty, so people will be notified in February. The semester starts at the very end of February, so my expectation would be that people would be notified in early to mid-February. If you apply and there's any kind of delay, feel free to contact me or the faculty to inquire what's happening with your application. But that's essentially the answer. And those people, there are some people who've already applied and already received notification, because some people apply far earlier than this, and so there are a number of people who are already enrolled in the program. Okay, I'm just I'll look at the next question. The next question says, are there any chances for internship during this course? The master's program itself doesn't directly organise any internships as part of the program. That's never been a feature of the program. So for those students who are seeking an internship, that's something that they will need to organise for themselves. That said, we do have good connections with a number of disability service providers here in Sydney and in New South Wales and elsewhere in Australia. So for those who are seeking to organise an internship for themselves, we may be able to assist you with some initial introductions to at least help you get your foot in the door in terms of trying to organise that. I will also mention in relation to internships that there's quite a lot of employment in the developmental disability field, and there's a bit of staff turnover in most organisations, so many disability service providers are routinely looking for staff, and the fact that you're doing this program would be of assistance. And so another way of obtaining experience in the field is, rather than do an unpaid internship, to actually seek some kind of paid employment in this field in addition to or instead of an internship. Okay, so I think I've answered all the questions that have been posted so far. So let me just wait on any additional questions. Okay, next question from Antoinette is, what areas of disability are graduates qualified to work in? Antoinette, because we focus on developmental disability, and by developmental disability I'm talking about people with intellectual disability, people with autism and people with cerebral palsy. For the most part, those are the three large groups that we concentrate mostly on. You're certainly qualified to work with people with those characteristics. We cover services and supports for people really from throughout the lifespan. So some of the people who have done the program have worked or are working in early intervention programs. Others are working in school settings, and many are working in adult services, and those services can include community living, respite, family support, sheltered employment, open employment, recreation and leisure, community participation, as well as people working in their particular specialised therapy area, so working as a speech pathologist or an occupational therapist, but specialising as a practitioner working with clients with intellectual or developmental disability. So there are a wide range of options, and to a substantial degree you can tailor your program to help support the direction in which you want to go. You will have seen that there was an elective about work, employment, and so that is of course particularly of interest to people who are looking to work with people with intellectual and developmental disability in some sort of employment environment, and that's a hugely important area that will become even more important under the National Disability Insurance Scheme. Okay, any more questions from people? Thanks for these terrific questions. They're really spot on, just what I was hoping for, and I'm sure very helpful to other people who are currently listening to the webinar or will be listening to the recording later on. You'll all be notified by email about how to access the recording if you want to do so, or if you want to share that link with other friends. Now I should emphasise, because the deadline for application is the end of the month, for those of you who are thinking of applying, then I'd encourage you to do so. If you've got some concerns about whether or not you will be eligible, as I indicated, there's a degree of flexibility. So again, I'd encourage you to apply and see how you go. It's important, if you are going to apply, to get started quite soon, because there is a bit of busy work involved in putting your application together, as well as completing the online form. You typically need to provide documentary evidence such as transcripts of previous training and so forth in order to support your application, a CV, etc., etc. So don't leave it to the last minute, but get started as soon as you can. Okay, I'm not seeing other questions popping up, so I'll just give you one last chance to ask any final questions. If not, then well, wait a minute. I think there's good. There's another question that comes through. It says, "Is admission competitive?" And I assume you mean by that, are there a limited number of places, and the places go to the best qualified applicants? Typically, we enrol between 20 and 30 students in this program each year currently. We have the capacity to enrol more than that. So although applicants have to be qualified on the basis that I explained previously with your training and experience, at the moment we have been able to accept all qualified applicants, and haven't rejected people on the basis that although they're qualified, they didn't make the cut-off, and so had to be rejected because there are too many applicants and too few places. So I guess the short answer to that is, if you're qualified, then you will receive an offer. Another question has just popped up. Do you have to have a clinical background to gain admission to this course? And the answer to that is no, but it's certainly beneficial to have had some face-to-face experience in interacting with people with developmental disability. Work experience as a clinician, a practitioner, a service provider in any kind of disability service environment is relevant and appropriate, so it doesn't have to be formally clinical in the sense of a registered clinician, and it doesn't even necessarily need to be work experience. We've had some absolutely terrific students whose primary involvement has been through, say, a family member who has a developmental disability, and sometimes those people work in disability services, sometimes they don't, but there are a variety of ways of gaining a practical understanding of the needs of people with developmental disability and successful ways of supporting them. So I would say that that kind of experience is highly beneficial, but doesn't necessarily need to be in the form of formal employed clinical involvement. So I hope that answers that question. So thanks everybody for your questions and for your involvement. I hope to hear from a number of you by way of application to the course, and for those of you who joined the course at the end of February, you'll be hearing from and seeing me teaching the core unit of critical issues developmental disability. So thanks so much, and bye for now.